Hello, my name is Dr. Kim Breeden, and I've practiced pediatrics in Athens and McMinn County for over 32 years. And I'll be honest with you, never in those 32 years have we faced anything similar to the COVID-19 pandemic. Your local pediatricians have banded together into a medical advisory committee, and we would like to share with you the state of the science today. You are being bombarded with information on television, on the computer, on social media, and this has never happened before. And so I can imagine that your head is swimming, because I know mine is. But you have to realize science changes. In the dark ages, we used leeches to leach out the bad blood and hopefully cure the patient. Science discovered that that was not a good idea, and the leeches went back into the ponds. Well, now leeches are used for microsurgery. If you've had a finger that's been torn off, it's been reimplanted, and we use leeches to increase the blood flow to that area. So science changes. It changes slowly, but it can also change very quickly. With the COVID vaccine, with the COVID illness, we have thousands, probably hundreds of thousands of researchers all across the world who are working on this. And when you've got that many people working on the same problem, the information comes at you moment by moment. If we had this roundtable 6 months ago, some of our advice would be different. If we have this again in 6 months from now, some of our advice is going to be different. But today we want to talk about the science as it stands right now. The first person who'd like to speak is Dr. Mia Matias, who actually has had training in infectious disease.
Good afternoon. I wanted to talk to you about what we've been dealing with, which is COVID-19, SARS-CoV-2, multiple names for it, which is coronavirus. Coronavirus has been identified since 1960, and it has commonly caused colds in multiple settings, and it's been fairly common. The difference between the coronavirus that we've seen since 50 years ago is that this coronavirus is a little different in the sense that it came from an animal and it infected a human, and that human now is passed on, and the infection is passed on from human to human. As you can see, the virus is called corona, as reflecting a shape of a crown with these spikes. And I'd like to point out that these spike proteins are very important in this particular infection, because that is how this virus enters the body and infects our cells. This particular spike protein, which we will talk about later, how we use to develop vaccines, is important in how this virus infects a human cell. So what typically it does is it attracts and attaches to a cell in this particular receptors, which is on all our cells in our body, called ACE2 receptor proteins. The problem is that this protein is in a lot of cells in our body. It's in our lungs, it's in our brain, it's in our intestine, it's in our blood vessels. Therefore, this particular virus can infect all parts of our body, which then can cause different kinds of infection. You can have a sore throat, you can have a headache, you can have diarrhea. And the virus is spread in all these different parts of our body. So therefore, we find the virus in saliva, in your nasal secretions, as well as stool. We'll go over that later. This is a picture of how the coronavirus infects a cell. If you're exposed to the virus through either saliva, or that's aerosols in the skin, in the air, or in contact with it, the virus enters the body and attacks different parts of your body in the cell. It attaches to this protein, that spike protein attaches to the protein on your cell, and then what happens is that allows it to be able to be taken up. And what happens is that the virus basically takes over your whole cell, and your body makes new virus, and then the virus is expelled in the body. So as you can see, the virus takes advantage of our body, and it then makes more viruses, and then which allows us to get very sick and also transmit the virus. You might be wondering what we're talking about when we talk about variants. Just like any virus that's multiplying, there are often mistakes in how it's multiplied. And during those times when they're in the community, if the infection continues to exist in the community, there are always mistakes in the way a virus is formed. There have been already hundreds of mutations of this particular virus. And the way it works is that there's a mistake which is in the DNA, and in the DNA, or the RNA, which is then causes the problems. And what happens is that when there is a mistake or a mutation of this virus, the mistakes are sometimes not that great, and so that virus or that particular mutation doesn't last in the community. However, what we found is with particular coronavirus is that there's been some mutations that have made the virus much stronger, much more contagious. You will see here there are identified alpha variant, beta, gamma, and delta. Alpha variant was first recognized in the United Kingdom. The beta was recognized in South Africa, and then the gamma, which is here, was recognized in Brazil. And now currently what we are finding that the delta is the predominant virus of the coronavirus that exists throughout our country. Delta is known to be 225% more contagious than the original coronavirus, COVID-19. In the past, the original virus, one person can easily infect two. The alpha variant was one person can easily infect four. Delta virus, one person can easily infect 5 to 8 people. If you look at some of the other viruses that we have in the past that are very contagious, chickenpox, one person can easily infect 10 people. Mumps can easily infect 12 people, and measles, as you know, we've had an outbreak of measles not too long ago, one can infect 18 people. Luckily, we have immunizations for chickenpox, measles, and mumps, and so therefore we're not seeing that as much. This is where we are today. Currently, as of yesterday, we have over 931,000 cases, total cases in Tennessee. 95% of those have recovered. The first case was identified in March 5th, 2020. Currently, there's been 23,473 hospitalizations, which is 3% of those who've been infected. There's been 12,392 deaths, which is 1%. As you can see here, we have noticed in the beginning of the disease, increased rise, and then here in November and through February, we noted a significant increase in cases. This is thought that the alpha variant, which is much more sophisticated, much more contagious, caused that rise during our past winter. However, now we are seeing an increase in rise in cases currently, and this is thought because of the Delta variant. The longer this infection exists in our community, the more variants will form. Currently, there is thought that there is a new variant which is coming from Peru. It is called the Lambda variant. This is our case since 18 months in McMinn County. As you can see, our first case was back here in March of 2020. Currently, we have 313 active cases. This increase here is partly because of the outbreak in our nursing homes. This here is the outbreak from the Alpha variant, and now you see, just like the others, that there is this rise in the end, and this is attributed to the Delta variant. You might ask, what's happening to our children? Throughout the last 18 months, there's been approximately 15.3% of children that have been infected. This is the latest data, which is collected from the health department, and as you can see here, the yellow line reflects the percentage of kids that are infected with this virus. In looking at the age group, the most common infected children are 14 to 18 years of age. So technically are high schoolers, and that's about 44.3%. Next age group is our 5-year-old to 10-year-olds, and that's 23%. And that's our elementary students. The third group is our middle schoolers, which is 11 to 13, and that's here, and that's at 17.5%. In the past 3 weeks, we've had an increase a percentage of infection in children. Throughout the whole 18 months, it's been at 16%, but 2 weeks ago, it was 20% of new cases in Tennessee are in children. A week ago, it was 21%, and this past week, it's 26%. Therefore, we are seeing 1 out of the 4 infections are in children. In McMinn, we've had a total of 914 total cases of coronavirus in children. Currently, in the past 2 weeks, we've had a total of 72 infections. Thank you very much.
Now we'd like to hear from Dr. Saji Gopinathan, who's going to discuss the dreaded mask.
So I think when we talk about mask, you always want to use common sense in making these decisions. Because I ask people all the time, if you're going for a surgery tomorrow morning and a surgeon is opening up your belly, do you want your surgeon to wear a mask? So the answer to that question always becomes, of course, yes. So if a surgeon can wear a mask and prevent infection from droplet infections from the surgeon's secretions, then mask does prevent transmission of infections. So in the case of coronavirus, it's a little different than the usual respiratory infections, especially the Delta variant, because the infectivity of the Delta variant is so much more higher than what we have ever seen. Having said that, the mask decreases the transmission. So the whole idea of wearing mask is to decrease the amount of transmission of the infection within the community. Now, it has been shown that the decrease in the rate of infection is around 50 to 70% decrease. So in addition to masking and social distancing, we can actually decrease the transmission to more than 70 to 80%. So we don't have many other options but to prevent this infection first, because once you're infected, as you know, the case fatality rate of this infection is almost 1%. So obviously we want to prevent us from being in a situation in which we were already infected. So the main thing that happens in coronavirus is spread through droplet infections. So when you're coughing or sneezing, it is being released into the air from your mouth and nose. So when you put the mask on, it prevents that spread away from your body. So that 6 feet distance is mainly coming because of the fact that if you are not wearing a mask, that your droplet can go up to 6 feet. However, when you put a mask on, that can be decreased to some level. Now the question is, what kind of mask can you wear? There are different kinds of masks available. Simple things like a cloth mask, which has multiple layers of woven mask. It should have multiple layers and it should be woven together. And if you wear that also, it's effective. Second type of mask that we have is the synthetic disposable mask, which is a non-woven kind of material, and that also works really well. And the third one is the synthetic mask that we have, the KN95 and other ASTM approved mask that's available. The N95 mask is mainly reserved for healthcare workers at this point in time. So the third question is, how do you wear this? The most important thing is to prevent the leak between your nose and the mouth out into the surrounding area. So it should be covering your nose, it should be covering your mouth, and it should be flushed on both the cheeks and under the chin. So anytime you have a mask that's falling off the nose, it's not helping at all. Now, when should we wear it? We should be wearing it anytime you are indoors with somebody else that's not in your family. If you are indoors with a family that you've always been hanging out, then you should probably not be wearing the mask. When you're outdoors, if you are having social distancing of more than 6 feet, you shouldn't be wearing the mask. But if you are outdoors in close proximity with somebody else other than your family member, then it's still recommended to wear the mask. Now, the different types of masks that's available, there is accessibility is a problem in some cases. So to be on the safe side, sometimes it's recommended to wear a cloth mask and then do a disposable mask over it. So I think in the middle of a pandemic, the least thing that we can do is to protect our kids at this point. The first time around, when the pandemic hit, the kids had lower incidence of infection, but that's not what we are seeing right now. In the last 3 weeks in our office, we have seen more than 40 cases of COVID that we have positive tested, and I don't know what all that we have not tested. So, and I have 2 patients in the ICU at Children's Hospital from our office. So it's affecting the kids. As responsible adults, I think it's time that we do the right thing for our kids, and masking is one of them. Thank you.
And now Dr. Rachel Worley would like to discuss the vaccine status.
So a lot of people have asked a lot of questions about this vaccine, and so I'm just going to run through some of the most commonly asked questions and some of the information we have as of right now. So the first question that we've all been asked is, was this vaccine developed too quickly? mRNA technology has been in development since 1985, so about 40 years of development that we've been working on mRNA vaccines. So it's not new technology. And then why did this COVID vaccine use that technology and get put out so quickly? Well, when you're in a global pandemic, there's a great need for a vaccine and as a protective measure. So all the resources across the globe were dedicated to this one thing, to developing this vaccine. So you had money and you had the best minds in vaccine development working together to get one vaccine out to help protect us. So we do not feel like it was rushed in the development phase. Then we say, how do you get enough numbers to have statistically significant information to know if the vaccine works? So again, we're in a global pandemic. We have very high case rate numbers. So when you start doing a study, like a case-controlled study, you're able to inject one group, the control group, with saline, and inject the other group, the case group, with the vaccine. And then you can, within about 4 to 6 weeks, get some good data to show the efficacious parts or the percentage of effectiveness of each vaccine. So when Moderna and Pfizer first put their vaccine out, we knew that we were about 95% efficacious in protecting against COVID-19, and then at the Johnson & Johnson was around 85%. So pretty good effectiveness in prevention of illness and particularly serious illness. An example that kind of gives you information, kind of helps you kind of understand these numbers, is that in regular flu season, about 100 million people get a flu vaccine, and so we get our numbers from that 100 million group of people. And as of right now, 353 million people have had at least one dose of the vaccine, and 167 million people have been fully vaccinated with the COVID vaccine. So we have lots of data at this point to compare things, and we know that these vaccines do seem to work very well. And it's not just, it's symptomatic COVID, but the biggest thing, of course, that we're most concerned about is cases of serious illness, hospitalization, and death, and what this vaccine does for that. So the Delta variant that Dr. Matias just talked about certainly is playing into this, and people are asking, well, is the vaccine working for the Delta variant? And we're just getting those numbers in now, but the answer is yes, it does seem to be helping, particularly for symptomatic illness, severe illness, and death. So I like this little schematic. This is one hospital in Houston, and it's just showing us if we have 85 hospitalized people, 10 of those might be vaccinated, and 75 of those were unvaccinated. In their ICU at the time when they made the schematic, they said, hey, we have 27 people in the ICU. Only 3 of those had been vaccinated, but 24 were unvaccinated. And on ventilators, all 11 people on the ventilator are unvaccinated people. So this shows us that it's protecting us against serious illness, and certainly against the complications that often are leading to the serious illness and death. So that is kind of with Delta variant right now. So right now, it looks like Pfizer is 88% successful against the Delta variant symptomatic illness, and over 95% effective against severe illness. 1 dose of Moderna, that's the data we have right now, is 72% effective against symptomatic disease, and 96% effective against serious illness. And then Johnson & Johnson is about 85% against severe disease with Delta. So again, very comparable to kind of what we saw before. It does seem to work. Then we get asked, does this vaccine become part of my DNA? And no, there's lots of videos that are posted about that and how the mRNA vaccines work. Dr. Matias gave us some information about that, and there will be other links to that information added at the bottom of this video. Side effects, that's the next thing that everybody wants to know is, am I gonna have side effects? So most people who are getting this vaccine are having mild side effects. Headache, injection site redness or swelling, maybe some fever, maybe increased fatigue, joint pain, things like that that are pretty short-lived for a few days for most people. Severe symptoms are very rare. And so out of every 1 million people vaccinated, 2 to 5 people have had anaphylaxis, okay, so a serious allergic reaction. And of course, because we know that that can happen, we watch people usually for 15 minutes after we administer the vaccine to make sure that they are okay and they don't need additional medical assistance. Out of 13 million doses of Johnson & Johnson vaccine, there were 39 reports of a rare clotting disorder. So you may have heard of blood clots happening. So 39 people out of 13 million doses. And out of 328 million doses of Moderna and Pfizer, there have been 2 cases of that clotting problem. So pretty statistically low numbers. Myocarditis is something we're hearing more about. That's an inflammatory condition of the heart, and we're hearing more about that, particularly in younger men and our adolescent boys. So that's a question we're talking about a lot. The actual confirmed cases thus far that we have 716 confirmed cases of myocarditis after the vaccine, and again there were 346 million doses of vaccine given for those 716 cases. That's a 0.0002% case rate, which is the same as the typical case rate for myocarditis in any given year, which is about 10 to 20 cases per 100,000 people. Though certainly it is a little bit higher rate in the younger men population than we typically see. So it's something we are looking at, but again, very, very low case rate. And then death is a very important thing people are asking about. How many people have died? When you look at the death rate after the vaccine, which may or may not be associated with the vaccine, every death that has happened within a certain period of time after receiving any vaccine has to be reported to the vaccine monitoring system, and that death rate is 0.00019%. And then when we think about actual disease, COVID disease, the death rate in the United States has been reported as high as 1.7%. So these two numbers are very different. So your risk of severe illness, injury, death from COVID, the disease, is much higher than from vaccine. And same thing with the heart problems. We know one of the biggest problems with this virus is that it affects the heart tissues. And we have seen a lot of increased heart issues, and that has been a big contributor to death, along with other complications, but especially cardiac complications. So again, vaccine seems to be much better risk-benefit ratio. And then just statistics aside, I think that it just makes a lot of sense if I ask each of you if in the last 1 year and 5 months, if you know someone who has been sick enough to be hospitalized or in the ICU or died from a COVID illness, many of us can say yes. And if I ask each of you if you know someone who has been sick enough to be hospitalized in the ICU and died after the vaccine, most of us would say no. So I think that alone is information. Another question we've been asked about this vaccine is, will it affect my fertility? The answer, according to the fertility experts and reproductive experts, is no. Who can get the vaccine? Anyone over the age of 12 who does not have a contraindication. Those contraindications are very few. Basically, you've had anaphylaxis before to an mRNA vaccine, or a history of Guillain-Barré, which is a specific kind of reaction we can have sometimes to vaccines. Those are the contraindications, but anyone over 12, pregnant and nursing women are encouraged to get this vaccine. Where can I get it? Lots of local doctor's offices have this, as well as Walgreens and CVS. Both Walgreens and CVS are just walk in and you may get your vaccine. The type of vaccine they have, Moderna versus Pfizer, it varies. Currently, today, we called Walgreens on Madison Avenue, and they have Moderna right now. Walgreens on Congress Parkway has Pfizer right now, and CVS has Moderna. And again, no appointment necessary for those. So I think the big thing is that these vaccines seem to be protective against the severe illness and death. And when we do that, when we protect ourselves, we also protect our children. Thank you.
Dr. Rucker, would you like to talk to us about quarantine questions?
Okay, I'm going to cover 3 different topics: isolation, exposure, and quarantine. The first one, isolation, involves a positive COVID test, somebody who is actually infected with the coronavirus. This is probably one of the easier ones. It involves being basically isolated from somebody else. If you have tested positive for coronavirus and you know when your symptoms started, that isolation begins the beginning of the symptoms from day 1 for 10 days. If you do not know when your first symptoms started, you may always have a runny nose, you may have other things. If you cannot definitely know when that first symptom started, or you were tested because you were around somebody with coronavirus and your test becomes positive, you need to go 10 days from the positive test. So if you test positive, you have 10 days of isolation. Isolation means you're staying away from everybody else. So even if you are in a household, you can be isolated in your household if you have your own room, your own bathroom, and you're staying put. If you have to come out for a little bit, you need to be masked. You can also need to stay longer than 10 days if you're still symptomatic at the end of the 10 days. So if you still have significant cough, congestion, any of those things, then you still need to be in isolation. So it's a minimum of 10 days in 24 hours symptom-free. The next one is exposure. Exposure means that you have been, irrelevant if you have a mask or do not have a mask, in close contact within 6 feet of somebody that is presumed positive or tested positive for the coronavirus. That means it doesn't necessarily have to be 15 minutes at one time. It can be over a 24-hour span, 5 minutes here, 5 minutes there, 5 minutes another time. If you are around somebody that's positive for a cumulative of 15 minutes in a 24-hour span, then you have been exposed. They also have made a little exception to that recently. If you are in a classroom and you are within 3 to 6 feet and you are a student only, if you and all those around you have both correctly and consistently worn a mask, then that does not count as an exposure. But those criteria have to be in place. Consistently and correctly worn a mask. Once that you have been exposed, then we have to go into quarantine, which becomes the complicated one. Quarantine begins the last day that you are exposed to somebody, or the first day that you're exposed to somebody. So if you are around, based on those exposure criteria, somebody who is positive, you start your quarantine that day. So there are different options for the quarantine as well. The gold standard is a 14-day time when you are staying away from everybody else. You quarantine yourself away from anybody so that you do not get anybody sick. That's been shown 14 days is when we shed the virus and we can give it to somebody else. So 14 days is the gold standard. There are other options to get out of quarantine early, as I say it. One is if you have been exposed to somebody and you have 0 symptoms, you don't have a headache, you don't have a sore throat, you don't have a cough, you don't have any diarrhea, you don't have anything that is different for you, then you can stay in that quarantine 10 full days. You can come out after those 10 days, but you must wear a mask the next 4 days because you still have a small chance of spreading that virus. The third way would be if you go and have a test on day 5 to 7, a quality test. We prefer, one that goes all the way back in your nose that nobody likes, but that is a good quality test. And if it is negative and you do not have any of those symptoms, you may leave quarantine on day 7. Again, you must wear a mask until day 14 because you still have a chance of spreading some of that virus. If you are vaccinated, you do not have to go into quarantine, but it is highly recommended that you wear a mask. You can wear it up to those 14 days. Can also get tested on day 3 to 5. If that test is negative, you are considered that you are not going to spread the virus. Other people that do not have to quarantine are those that have had coronavirus in the last 3 months and do not have a new or significant symptoms as well and think that they need to be retested. But within those 3 months, it is not required that you quarantine if you've had the coronavirus priorly.
Let's say that you've done everything and you've had coronavirus in your household. There's a couple of things that can happen over the next few weeks that we need to be aware of, and a lot of people are not. The first group I'm concerned about are our young athletes. As it's been mentioned, this virus can cause heart inflammation. So any athlete who has been diagnosed with COVID should be evaluated by their doctor prior to returning to sports. We will review your illness. We'll find out, did you have a fever for more than 4 days? Did you have significant breathing problems, chest pain? Those people need to be seen and evaluated. Sometimes we can screen you out and say, yes, you can go back to sports. Other times we may recommend an EKG, we may recommend an echo. We have had some patients who had significant enough illness that we then sent them to a cardiologist. It's very similar in thinking to the return to play after concussion. So if your athlete has had COVID, you need to see your doctor and get them cleared. Coaches, if you know of an athlete who's had COVID, please make sure, even if they had their sports physical 3 months ago, if they've had COVID, please make sure that they are screened before you return them to training. The other issue is there is a condition called MISC, M-I-S-C, which stands for multi-symptom inflammatory syndrome in children. The thing about this condition is it appears 2 to 4 weeks after a COVID infection. Your child is fine, they're back to school, then all of a sudden they spike a fever, they get bright red eyes, they may get a rash, a sore throat, terrible fatigue, similar to what you might see in a child with mono, vomiting or diarrhea. Those kids need to be reassessed, because what happens with the COVID virus is as the virus gets into the body and the body starts fighting the virus, the body gets carried away and fights against itself and causes ongoing damage. And those children may have long-term permanent heart damage. So if that child has had COVID and then 2 to 4 weeks later you see a whole bunch of other symptoms start up, you need to get back and see your doctor right away. In addition, what makes this condition extra tricky is that some of these children had such a mild case of COVID that nobody even knew that they had COVID. And so they may present with the symptoms, this MISC condition, and you don't even know you've had that virus in your family. So at this time, if your child has a sudden unexplained fever and any one other symptoms, red eyes, sore throat, fatigue, chest pain, cough, vomiting or diarrhea, please get back and let us help you sort through that and make sure that you have not had an undiagnosed case of COVID that is now leading to this dangerous side effect. Anybody else have anything they want to add? I want to thank you for listening, and I think I can speak for all 5 of us. If we've said anything that concerns you, you have a question, we've confused you, please call. We would much rather clear up any misunderstanding or help you as you navigate your way through this craziness. Thank you.